Our next guest is Dr. Sheri Margolian. She's a dentist who cares so much about dental health. She and her team at Margolian Dentistry are hosting a free dental day in Durham. Sheri, welcome to the show.
Thank you.
A free dental day in Durham. Tell me a little bit about it.
So it's going to be on November 1st. It's going to run from 8 a.m. to 4 p.m. And how it works is it's first come, first serve. So the earlier you get there, the better chance you'll get seen. And we're offering each person either a cleaning, a tooth filling, or a tooth removal.
And so is this your first year?
So we've actually run it at another location in Bowmanville a couple of times. We were able to see over 50 people. And this time we're having it at our office in Whitby at Margolian Dentistry. And we're hoping to see even more than that. It's going to be myself, my husband, Dr. Mark Bashara, and my father, Dr. Steve Margolian, as well as 2 hygienists. So we'll have a lot of people helping out, and hopefully we can see a good amount of people.
And what made you decide that you wanted to help the individuals in Durham region and put on a free dentistry day?
So helping people has always been really important to me and everyone at my office. But for me, what really inspires me is when I see families who bring their children in and they always get regular checkups and cleanings and fillings, sometimes even braces, but the parents, they only come in when they're in pain or they have an emergency. So they, rightfully so, put their kids first and themselves last. So I'm hoping with this I can help out some of those parents who are always at the end of the totem pole. They can help out some of them who always put themselves last.
That's such a great idea. And you're talking about parents putting themselves last. Is it sometimes because it's a financial reason, or do you find it's more a fear-based thing? Because I know a lot of people are sometimes afraid to go see the dentist.
So those are 2 of the biggest factors. A lot of it's financial, and then when you have limited resources, you always want to put your kids first. And some parents are afraid also, right? So we do offer things like sedation, all the way from laughing gas to being fully put to sleep for the work, and that's usually really helpful for a lot of people.
I know it's helpful for me. I'll have to admit to you that when I go to the dentist to have dental work, not the cleaning part, but I'll have gas because they said that my nerve endings are just so askew. It's really hard to freeze my mouth. And the one time I tried to get frozen, it hit the nerve and I went right through the,
oh, no.
right, not literally through the roof, but it was pretty painful. And is that because I've heard, and I'm not sure if this is accurate, but is it because when we're so nervous also, the adrenaline can cause the freezing to wear off more quickly?
Yeah, anything like that you can burn through the freezing a lot faster. Also, if you have a really infected tooth, if you come in, you wait a little bit too long, then the freezing won't work as well. You have to calm the tooth down with antibiotics or anything like that, because infection also will eat through freezing a lot faster.
So what is the kind of sedation that you do offer if people do need that?
So we offer laughing gas, which is nitrous oxide, as well as an oral sedative, which is basically a sleeping pill. So that will make you kind of drowsy and out of it. Has an added benefit if sometimes you forget what happened, like you wake up and you didn't even know you went to the dentist, so that's a nice feature of it.
Oh, those are such great services. I know when I've had the laughing gas, again, I'll just admit this to you. Have you ever had this in your chair? It actually does make people laugh.
Yeah, for sure.
And sometimes I'll think, I'm having this great idea. I got to write that down. And then after it wears off, I think, well, that was the dumbest thing I ever thought of.
Oh, no. I haven't gotten any of those reports, but.
What's your favorite thing about what you do? Because it is such a great service, and it provides such self-esteem, and it provides such great health benefits. What do you enjoy most about being a dentist?
I love when I can take somebody who, really has been down with their appearance and been self-conscious, and then really make a big difference, and they come back and they tell me how happy they are. I really love that. And I'm hoping with this free dental day I can help out a lot of people who didn't think that was possible for themselves. And for people who have really limited resources, we are going to run this every 6 months around. So if you can only come in for free, then you'll keep coming. We want to help you out. And if you can, come in for a free consultation. We can go over what you may need more than what we can do in that one day. And we do offer interest-free payment plans. So if you can only pay a little bit month to month, and we can hopefully work something else, because I love to help out people before it's too late, before it's only hopefully not a tooth extraction. If we can get you in sooner and take care of it when it's smaller, that's really key.
You're right, it is key, because if you can catch it before you need more work, it's going to save you in time, it's going to save you in money, and it's going to save you in that anxiety that's starting to build because you're putting it off too late. Mm-hmm. So you had also mentioned that you said you have free consultation, so people can come and see you before this day?
Yeah, so for this day, it's come, first serve to have one service done. But in general, at our office, if someone wants just to come in and talk about their overall oral health, what they may need, implants, dentures, you name it, then we'll sit down and have a discussion. We won't charge you for that time. If we need to do anything, x-rays, that's different. But we'd like to sit down and just make you feel comfortable, talk about what you need, and we won't charge you for that time.
And what is the biggest change you have seen in someone who's come in that's maybe put it off, and now you said it helped their self-esteem because they are loving their smile? What's one of the biggest changes you've seen?
Well, they come in smiling. That's the biggest.
Yes.
A big smile on their face. You know, I've had a lot of older people come in and they're saying, you know, now my grandkids, you know, aren't asking me questions. You know, they got a full smile again, whether it be implants or dentures. But they usually come in and they're very, very happy. And I'm always happy to see them smiling that time.
Thank you so much, Dr. Margolian, for being here, but also for putting on a free dental day in Durham region. It's a great service.
Great.
Up next, Just Book It with Michelle Jones, a message that could save your life. We'll be right back. For over